But coming to you, Ms. Khosla. So again, jumping right in, I do remember you telling me, I think a few years back when we were chatting, and you did say that there's this list of universal allergens, and probably gluten falls is one of them. Correct me if I'm wrong. And a lot of people come to me and also ask me that is a gluten-free diet actually healthy? And even if they are on a gluten-free diet, they might ask about cheating on their diet, and they say, "Ki, okay, we are on a gluten-free diet, but on the weekend we want to go and dine out with our family or have something nice at home. So can we cheat? How much gluten is too much gluten? And what is this entire issue of cross-contamination? If you can answer these questions." You're on mute, Ms. Khosla.
Yeah, great questions, Arjun. The first is a gluten-free diet a healthy diet? So I'll make a generic remark here that, in general, we have a tendency as practitioners and as researchers to oversimplify facts, especially to do with nutrition and food. For example, we related sugar with diabetes, we related salt with hypertension, fat and cholesterol with heart disease, and we went on a absolute mission to get these corrected so that we thought we would arrest these, and nothing like that happened. In fact, even calories, we thought we will go on a low calorie diet or burn more calories and deal with obesity, but nothing like that happened. So simple oversimplification of any science can lead to problems. And this is also true with gluten. So just removal of gluten alone is not going to make you healthy. It is meant to be removed, and actually having gluten or having a leaky gut is associated with malnutrition, with malabsorption, and several other conditions like Dr. Tom just mentioned. And it's obviously logical that when we remove that irritant, it should translate into better absorption and better nutritional status. But it may happen, it may not happen, because it depends on what kind of a gluten-free diet and what kind of alternatives you are choosing. Clearly, if I replace my chapati with rice, which is polished, or I buy a processed, say a cracker or a biscuit or any bakery product which has gluten alternatives, it may not have the right ingredients. And more often than not, we do find additives and highly refined starches which are low on nutrition as alternatives and ingredients in these products. And that's where the problem starts. So simply elimination of gluten is not going to do it, like I'm repeating. And in general, good health is arrived not by removing harmful products from your diet, but also by adding useful products. So that is very, very important. And therefore, choosing the right alternatives and having a healthy gluten-free diet, which really means plenty of vegetables, plenty of fruits, plenty of good fats, prebiotics, probiotics, and fiber, is critical to a diet which is central to a gluten-free diet. Arjun, you do lab work. How many vegetarians do you see with good lipid profiles, with healthy profiles? Doesn't happen. So just being vegetarian is not going to do it. So likewise, just being gluten-free is not going to do it. A healthy gluten-free diet, which has adequate proteins, like I just mentioned, good fats, fiber, phytonutrients, antioxidants, etc., and a good lifestyle is critical. So make sure you make the right choices when you are on a gluten-free diet. Question 2 was on can you just
cross-contamination,
right? So cross-contamination is an excellent question, because we do see that as an important part when people are on a gluten-free diet and are not healing or not getting the right kind of results. It starts from simply flour mills. where we grind our grains. So in India, for instance, alternatives to wheat include millets, bajra, jowar, ragi. All of these are mostly being ground in mills which are also using wheat. And that makes it contaminated and adds the element of gluten, which can be causing continued symptoms. To be very precise, a level of less than 20 parts per million is considered gluten-free. So clearly these will never meet that standard and can be a problem. So cross-contamination from the ingredients to wherever you are producing your food, your own kitchen, where products could be, the dusters could be common, the working surfaces, the tawas, the pans, all of that could be contaminated, or toasters on other equipment like that could be causing the cross-contamination. So it's a very simple, common sense way of dealing with a complete exclusion and completing the hygiene to 100% as far as possible to ensure that cross-contamination is minimized. And cross-reactivity. Did you ask me about cross-reactivity?
Yes, that's
so yeah. So that again is something to do with the immune system. In a certain way, the antigen is getting the antibody response, which was meant for some other food, and the antigen is getting the same response. So it's to a certain extent molecular mimicry. It is falsely being attacked. So a lot of foods that we consider safe as gluten-free can be behaving like gluten because they trigger the same immune response by the body. And they so for instance, corn, soya, oats, even there are some minor grains, amaranth, which are gluten-free and very healthy. And they do evoke the same reaction. So it's important for anyone who is on a gluten-free diet to understand the science. And very often, these are also part of gluten-free products internationally because they are listed as gluten-free and they are gluten-free. And mostly we find that they are triggers for most people. So it's important to understand this concept that just simply going gluten-free may not be, causing complete remission of your health condition.
That's very, very enlightening, Ms. Khosla. Actually, I have patients who come to me and get their TTD checked on follow-up, and it's always elevated and they're always helpless. But it's very helpful for them to understand how to avoid these cross-contamination and probably go at the root of how the grain is actually being produced to the mill. And that was my next question, and related to the biopsy also, and that is the gold standard. But before that, quickly coming back to diet, I'm going to ask Miss Ishi just about these two three things that have always puzzled me. And so there are a lot of people who actually go off soya and corn, and that's always puzzled me. Why is that the right thing to do? The second one is this entire dilemma surrounding oats, and are they really gluten free, or there are certain that are gluten free, so should they really go for that? And then the fourth one would be, what is the status of dairy then? Are we just talking about reducing inflammation, and then does milk and dairy also play a crucial part in reducing that inflammation if we go off it? Sorry for bombarding you with so many questions, but it's only in the essence of time.
So it's not only you who is bombarded with these questions, it makes the two of us. It's my story too. And yes, the question regarding soya, corn, and dairy, oats, of course, is again going back to the previous conversation that we had on cross-reactivity, that they in themselves are great grains. Soya is wonderful food. There's no denying that. Corn has its own fabulous benefits. And they have been part of very traditional diets in pockets of the world. So there's no way we can denounce these, and why we don't need to do that. However, whatever the grains are, if the immune system mistakenly attacks these or targets these as antigens and makes antibodies against them for whatever reasons, like I tried to explain to you, like it mimics gluten in a certain way. then they become undesirable for you. So they may, in celiac disease, we also have a few studies to suggest that corn and soya have caused villus atrophy. We don't have robust data on it, but it is there in a few studies. And science will evolve around these grains as well. So the question is not gluten here. Here there's something else, which is, like Dr. Tom said, maybe other parts of the grain, or we don't know exactly what triggers, but certainly they behave like that. And I can support that with my clinical experience. That many times, in fact, I'm reminded of a young girl in her 20s who was studying in the US college, and she was celiac. And she refused, she was doing everything right in terms of following a gluten-free diet, but she included oats in her diet as a routine, because oats are healthy again. There's nothing wrong with oats. And all the products that she ate were gluten-free technically. But she was not gaining weight and stamina, and it was almost 4 or 5 years for her to be on the diet and not getting much relief, to the point where she was not even allowed to travel outside for a course that the college was sending her, because she was so underweight and so tired. And so she landed up in my clinic first, I don't know how. And when I took her diet history, I found this was happening. And all I did was I said, that's the only mistake you're making, and get it out and let's see how you do. And sure enough, within a few weeks, I got a thank you message from her parents that she's turned around, she's feeling better, stronger. And after a few months, she was also allowed to travel for her course. So these are things which we are seeing. It's not theory, it's practical experience. So these are certainly new learnings that we have. In fact, as a matter of fact, in my book, Is Wheat Killing You?, which I did way back in 2008, these are permitted grains. So this is new science, and we need to understand the reasons behind it, and also make our guidelines accordingly. The question on dairy is very, very important, because dairy again is gluten-free, but dairy has two parts to it. One is the lactose and one is the milk protein, which is casein. Because of the leaky gut, which Dr. Tom talked about, there is what we call an imbalanced gut flora, gut microbiome, a dysbiosis, so to say, which also reduces our ability to handle certain sugars, which is like milk sugar, lactose. We may not make enough quantities of lactase in our system and in such bodies, and with certain people with certain age, we are unable to deal with the lactose in milk. So milk certainly can be an irritant for most people who have a gluten problem, but not all. Certain people are completely all right. But the question is, I would say, I can't give you an exact number by research, but roughly about 50% of people who have a gluten problem also react to dairy. And whether they are reacting to lactose or to dairy protein, which is casein, is hard to say, but it is an issue. So it has to be, we don't have guidelines to say that everyone who has a gluten problem should be off dairy, but it will have to be something that you as an individual or as a, your patient need to understand your tolerance. However, if you have certain established conditions already, like for instance, autism, or for instance, diabetes, we know that dairy is something which should not be a part of the diet. So it is early days for us to make guidelines for everybody, but certainly it is a food which needs to be taken with caution. And very often I'm asked, oh, dairy for children, calcium for their growth, and as a probiotic, how can we eliminate dairy and why should we do it? Only if we need to do it, we should do it. And at what stage it is done, it needs to be worked on. But it is not as black and white.
Thank you, Ishi, for that very, very nice answer. And quick question to Ishi. And this is one question that I get asked very regularly again. And going gluten-free has become a fad, and probably last year also it was very popular. during the pandemic, everyone was at home and trying new diets and trying to lose weight. But is gluten-free really a good diet to lose weight? And also, second thing again is people who are celiacs and have any kind of gut permeability issues, they do come in for follow-up testing. So are there any nutritional tests or any specific tests that you would advise our patients who come in for follow-up testing?
Yes, great question here in the backdrop of the pandemic. A lot has happened with the use of antibiotics and also the shift in gut microbiome post vaccinations and post COVID itself, post the infection. So a lot how people have suffered on account of that. And let's not discount the effect of prolonged stress and stress related issues, which have also been a part of the pandemic. All of that causes what we call a shift in the gut microbiome negatively. And that definitely warrants probably a shift in diet and in many people whose symptoms are not resolving or who have landed up with symptoms or conditions like diabetes, high blood pressure, and skin problems and other immune problems. I see it all the time. And my own patients who are very well controlled diabetics are not as well controlled now because of all of this. So there is a merit in looking out for food sensitivities in such patients, and elimination of inflammatory proteins, particularly in the form of gluten and dairy and the other grains we've already spoken about, is warranted. But I would suggest if it is done by anybody, it should be followed up by professional advice and not made into just a casual thing of eating it on and off or a low gluten diet. So that becomes a problem. In fact, I missed answering your question on cheating. On and off. So, and I know Dr. Tom's view on this, and I resonate with that completely, that there is nothing known as a low gluten diet or a cheat day or something as far as gluten is concerned, because here you are really trying to heal your intestines and reduce the inflammation and, correct, seal the leaky gut. So that can be completely, even with, like I said earlier, 20 parts per million, the immune system reacts. So there is little room to say yes to cheat as far as this particular aspect is concerned. But yes, you can have your favorite foods in the alternative world, absolutely, once in a while, and that's perfectly fine. So coming back to the question on, the need for doing this, look out for food sensitivities, particularly for people who have suffered, and modify your diets accordingly. And the second part of your question was on the follow-up for patients who come with these problems. We definitely need to do, there are two kinds, the celiac and the non-celiac. For celiacs, we definitely would like to monitor their TTG levels and to ensure that they are, well within the permissible levels. And, not that celiac, sometimes patients say, oh, our celiac markers are okay now, but we still have symptoms. So celiac disease markers like TTG are not very sensitive markers for contamination issues, etc., and or to tell us that there is damage going on. So that is a very important understanding by all who are listening, that just because your TTG is normal does not mean that there is no inflammation going on. So, and if you are, particularly if you're having symptoms, but we do need to ensure that these are well within normal. And along with that, I personally like to monitor antibodies to thyroid, to H. pylori, sometimes it's needed, and to ensure these are all in place. And if you have rheumatoid arthritis, etc., to work on those. But more importantly, I monitor very, very closely levels for iron and B12, vitamin B12, and vitamin D. Of course, calcium, magnesium also, but more importantly, vitamin D levels. And we have spoken a lot about inflammation in this session, and vitamin D is one of the key vitamins which helps in controlling inflammation. And Dr. Tom has a lot of good data to share if we have time on vitamin D and COVID and the immunity. But having said that, these are the few things which I typically do. And plus, if the patient is diabetic, and other markers are also tracked.
Very helpful. Very helpful, Ms. Khosla.
Ms. Khosla, thank you very much. And since you are in Delhi NCR, and if you're okay with it, given the pandemic, I'll wear a double mask, I promise. And I will come and deliver your certificate in person to you at a time of your convenience, ma'am.
It would be a pleasure.
Thank you.